A very good afternoon, and we are starting this webinar series for a lot of aspiring PMU artists as well as for people who are interested in getting permanent makeup done. So we are going to bust a lot of myths and introduce a lot of facts in our series of webinars. We are hoping to hold one every week. So let's start with this first one. And the topic for today is something that people have been asking me all the time in our world of microblading and micropigmentation. The topic for today is microblading a tattoo? So after this webinar is over, after this video, I would love for all of you to put into the comments on this video down there. What is your opinion after watching this video? Is microblading a tattoo or is it not a tattoo? Okay, I'll be waiting for your comments. So let's start with the whole concept of microblading. So microblading is just one of various types of permanent eyebrow makeup techniques. It's not the only one. However, it is one of the oldest and hence it's one of the most popular techniques among clients as well as for people who are aspiring to learn PMU. So whenever we get inquiries, everybody's like, oh, I want to learn microblading. Oh, I want to get microblading done. So we are going to bust a lot of myths about microblading. However, artists across the world, globally, if we talk about not just here in India, microblading is kind of becoming obsolete. People are opting more and more for other techniques apart from microblading. So we'll get to know more about those techniques also in the upcoming webinars. So microblading and other types of micropigmentation essentially form the world of permanent makeup. So microblading and PMU is how we call it. PMU stands for permanent makeup, and microblading and PMU go hand in hand with each other. And today's question of $1 million is microblading a tattoo or not? So let's first understand the very definition of microblading. What exactly is microblading and what exactly is a tattoo before even microblading, because the topic of today involves microblading as well as permanent makeup. So let's discuss about what defines a tattoo. So the definition of a tattoo is any sort of colored substance when implanted into the skin, either deliberately or accidentally, is a tattoo. So what I have here and here, all these are tattoos, and what I have on my brows is also a tattoo. So let's come to the point about how are tattoos classified. So the classification of tattoo is primarily there are two types of tattoo. One is an intentional tattoo and the other is an accidental tattoo. Now we're going to delve more further into the world of intentional tattoos. Intentional tattoos once again are classified into four types. One is a design tattoo, there is a cosmetic tattoo, there are paramedical tattoos, and there are purpose tattoos. So we are going to understand each one of them and the difference between all of them. So a design tattoo is something that is created to be different, to distinguish oneself from other people, and it is different from the natural attributes. Like say, for example, I have this paw print here or a dolphin on my hand. So these are design tattoos. This paw print here is not to enhance my natural features or anything. Neither is this dolphin. So they are different from the natural attributes of the human body. This can be for identification purpose, or can be for a religious or social expression, or it can be for one's own idea of beauty or opinion expression. I have a paw print because I love animals, because I love dogs. I have a dolphin for the same reason. So these are all design tattoos, which are more to express one's own identity and one's own opinion. Then we have cosmetic tattoos. We are going to talk a little more about this. A cosmetic tattoo is something that is done to enhance the natural attributes of the human body. Say, for example, eyebrows. Eyebrows are already present on people. Lips are already present on people. Eyeliner. So eyeliner is basically to give an enhanced look of eyelashes. So eyelashes are already present. Then we have something called scalp micropigmentation. So people who have low density of hair or who have lost some hair on the scalp, they want to recreate the look of hair which would have been there naturally. BB glow facial is to recreate the look of that, smooth, glowing, baby-like skin, which we were all born with. Then there is beauty spot creation. So beauty spot creation may or may not be present in everybody, but yes, it is a natural occurrence. And it has been given the name of a beauty spot because it makes the face or body, wherever it is, it makes it look more beautiful. That is our human beings' idea of beauty. Then there is areola enhancement. Now, areola enhancement and areola recreation or creation are different. Okay, so areola enhancement is in a person who has not had any surgery or trauma or anything on the breast or areola, but the areola color is very light and they want a darker looking areola and nipple, and that is when we do areola enhancement. So all of these are a part of cosmetic tattoos, where we are trying to enhance the look of natural human body attributes like eyebrows and lips, areola, beauty spot, eyeliner, hair, etc., which are already present on the human body, but they may not be as beautiful as is our human being's idea of beauty, or they might have been deformed over time, like people's eyebrows thin out, or the lips become dull, or they lose hair on the scalp. So it can be naturally not as great as one wants, or it may have faded over time. So that is the cosmetic tattooing, and microblading is a part of permanent eyebrow makeup, which is a cosmetic tattoo. So yes, in this portion of the webinar, we answer our question of today: is microblading a tattoo or not? Third is the paramedical tattoo. So these are all intentional tattoos. Okay, so the third one is paramedical tattoo, a tattoo that is created to recreate the natural attributes of the body. So the earlier one was to enhance, and this one is to recreate something that has been lost. This can include vitiligo micropigmentation, for example, where people have lost the natural color of their skin, and because of that, they have whitish patches known as vitiligo. So vitiligo micropigmentation is done to recreate the look of natural skin. Scar camouflage. So the skin has been disturbed by some or the other type of injury or surgery or something, and we are trying to camouflage it and trying to make it look more natural. So we are basically trying to recreate what was there earlier and is missing now. Then we have something called stretch mark camouflages. Now, stretch marks can be caused either because of either during pregnancy, or it can be caused because of over exercising or sudden weight gain or sudden weight loss, etc. And the stretch marks are initially reddish in color, erythematous or reddish in color. And over a period of time, the stretch marks become more white in color. Now, those are very, very visible because the skin is whitish and shiny. So people want to have a camouflage and make it look closer to the natural skin color, which is already there around the stretch marks. So here we are trying to recreate the natural skin color on the stretch marks. Then there is birthmark camouflage. Now, birthmarks can be darker than skin, birthmarks can be lighter than skin. All sorts of birthmarks cannot be very effectively camouflaged by a tattoo. So sometimes people also do a design tattoo. For example, on my own wrist, I had a birthmark, which is like a little darkish brown in color, and I covered it with a design tattoo. So this is not a paramedical tattoo, although it is covering a birthmark, because birthmarks correction with the help of paramedical tattoo is meant to recreate the look of normal skin and not have a dolphin on one's hands. Okay. Then areola creation. Now, areola creation is done in people who have had a surgery or some sort of trauma on the areola region and want to create the look of areola. So a lot of cancer patients who have had a mastectomy, which is removal of a breast, and then using another muscle of the body, a breast-like structure is created. But of course, the natural areola and nipple would be missing. So that is something we can recreate with the help of a tattoo. Then many of you might not have heard of this, but webbed toes correction. So webbed toes are when some people have two fingers or two toes partially or completely joined. So basically this part of the line is missing, and it looks like webbed toes. So like frogs have webbed toes, the toes are joined from this portion. So it's not very pleasant. It's not matching with a human being's idea of what is natural or what is beautiful. So what we do is we create a tattoo which actually looks like this kind of a line. And so, say for example, these two fingers are normal and these two fingers are webbed. So normally there would not be this darkish line over here. But then we create a tattoo, a three-dimensional line type of tattoo, which also creates the impression of a little bit of depth, because it's not just a difference in color, it's also a difference in the depth. So here, the birthmarks and areola, web toes, all can be recreated with the help of a paramedical tattoo. Now, some people would have lost their nails, fingernails or toenails, because of some sort of injury or some sort of disease, and or even if their finger is, say, partially cut off, and now the remaining finger is there, but it will not have a nail over here. So a nail like tattoo can be done on top of the at the tip of the fingers or toes to make it look like a nail. You're not recreating a nail, but you're doing a tattoo which looks like a nail. Okay. Then, last but not the least, there is corneal tattooing. In fact, our brand eyebrow brands pigments are used for corneal tattoos also. So, corneal tattooing is when a person has a corneal opacity. So, basically, the person has already lost their vision. They are not able to see, unfortunately. But also, what happens is because of the corneal opacity, this portion of the eye, the black round circle portion, starts looking whitish or opaque, because that is where the cornea is, and it has become opaque. You cannot see through it. So that looks very unnatural, and for the person who is suffering from that, it becomes very uncomfortable, because people keep staring at them and wondering what happened. So in corneal tattooing, we take pigment or ink and put it inside the eyes. So we don't do that. I mean, of course, ophthalmologists do that, eye surgeons do that, but we as in human beings, we put ink inside the eye to recreate the look of a natural iris and pupil. So those are all paramedical tattooings. So now we'll talk about accidental tattoos. So the intentional tattoos, we have design tattoo, cosmetic tattoo, and paramedical tattoo. And in the accidental tattoo, we have traumatic tattoo, gunpowder tattoo, and minor tattoo. In traumatic tattoo, there are things like, accidentally you have hurt yourself with a pencil and the tip has stayed inside, or you have accidentally injured yourself on some sort of colored substance which has entered your skin and stayed there like a tattoo. Now this purpose tattoo is actually a part of the intentional tattoo. So I'll just explain the purpose tattoo thing to you. So a purpose tattoo is created to identify. It's created to give identity to a person. Now this includes war tattoos. Now during war, what happens is, unfortunately, during wars, a lot of bodies are mutilated or beheaded, and it is difficult to recognize who the person is, or who is from which side. Like in a war, there are two countries or two parties which are fighting against each other. So at the end of the war, it becomes difficult to recognize who is from which party. So war tattoos are done specifically to identify dead bodies. There are prisoner tattoos. Now, in a lot of prisons, they put either the prisoner's identification number or some sort of a mark, so that when the prisoner, if they try to escape, people will know that this person has come from a prison. Or even within the prison, it becomes easier to identify the people by putting tattoos on them. Then we have name tattoos. Like nowadays, a lot of people put the name of their spouse or their children or their pet or something or the other, or their own name for that matter. And those are name tattoos. and it gives a sense of identity to that person. Tribal tattoos in the olden days, each tribe used to have their own style of tattooing, and they would do it in a very traditional way. And these tattoos were used to identify or differentiate one tribe from another tribe. So this was very, very prevalent in Africa and India, and the Native Americans. So those every culture that has had a tribe culture has a history of tattoos. Nowadays, tribal tattoos are also a fashion statement. So I've seen a lot of tribal tattoos on people's arms and all that. Then there are memory tattoos, like, say, for example, one date is important to me and I'll tattoo that date. Or I know of people who have tattooed the latitude and longitudinal coordinates of a place they love, or people have tattooed the birth dates of their children or something like that, or the face of a loved one. So those are memory tattoos created to remind the person of whatever the tattoo stands for. So those are the four kinds of uh, intentional tattoos, I would say: design tattoos, cosmetic tattoos, then we have the paramedical tattoo, and we have the purpose tattoo. So yes, microblading is a tattoo. Let's hear a few fun facts about microblading before we end this session. Yes, microblading technically is a tattoo, but also, yes, it is different from conventional tattoos in terms of the type of the pigment that is used, in terms of the depth at which the pigment is placed, and also the technique of pigment placement. Because in traditional tattoos, we use needles. In microblading, there's a blade which is used. It's a microblade, but a blade nonetheless. Microblading is also a manual technique, whereas tattooing is a conventional tattooing, I'd say, is a machine technique. Also, the other types of cosmetic tattoos, like, you have your ombre powder brows, and you have your lip micropigmentation and scalp micropigmentation, BB glow, eyeliner, blah blah. All of those are once again machine techniques. So they are tattoos as well, but the depth of placement and the type of pigment used is different from conventional tattoos. So what is also true is that microblading or any other permanent makeup procedure, or any cosmetic tattoo for that matter, is semi-permanent. It is not permanent. So over a period of few months or years, the cosmetic tattoo is going to fade off and you might need to get it redone. Although microblading is one of the most popularly known names for permanent eyebrow makeup even today, it's not actually the best procedure to opt for. There are a lot of downsides to microblading, although it does look beautiful. The downside is that it can cause scarring over a period of time. Also, there are a lot of skin types which are not suitable for microblading, and there are a lot of aftercare needs to be taken for microblading. Also, if the person is suffering from any sort of comorbidity, then microblading is slightly more risky than other permanent eyebrow makeup procedures. So it is not the best technique, although it is a wonderful technique. So if you want to know which is the best technique for permanent eyebrow makeup, follow our YouTube channel and keep watching for more webinars. And for any sort of cosmetic tattoo procedure, your correct client or patient selection and setting the right expectations to your client about what kind of results to expect, that is the key to achieving great results. And even a bigger key is to implement the correct technique and use the right sort of products. I shall be looking forward to hearing from all of you in the comment section about what was your experience with this webinar and what topics would you want to know about in the upcoming webinars. Thank you so much for listening to me, and thank you for being here. Although I tried to keep the webinar very short in order to not bore you to death. Hope to see you again soon. Thank you.